Just bring in our friend, Dr. Richard Besser, head of the Robert Wood Johnson Foundation, former acting director of the CDC. Good to see you again, Rich. So we know there's some confusion over the vaccines, but overall, vaccines are ramping up. Cases are coming down across the country. Hospitalizations and deaths are down as well. Is there a case for optimism right now?
I think so. I am clearly cautiously optimistic. When you see a curve like this that's going down and steadily down, and a ramping up of vaccination across the country and in many places around the world, you have to be hopeful that we are on the path to this being over.
What's behind the drop?
Well, George, there's a lot of debate around that. In the United States alone, probably close to 100 million people have had this infection. And now you have close to 40 million people who've had at least one dose. Those numbers add up to a smaller proportion of people who are susceptible. You add on top of that, finally hearing the same messages coming out of the White House that we hear from public health leaders about wearing masks, keeping apart, washing our hands, limiting travel. All of those things that we're doing, I think, are having an impact as well.
We still have these bottlenecks on vaccinations. What's the best way to speed the administration of these vaccines right now?
Well, the federal government's doing things, I think, that give me hope. These mass clinics are important. Getting vaccines to local pharmacies, giving vaccines out in communities. Because it's not just about speed. You have to look and see who is most vulnerable, who's been getting this infection. How do we get this to essential workers who work all day, people who may not have transportation to get to these mega centers? Black, Latino, Native Americans have been hit the hardest, and some populations can be very challenging to reach. And there's an increasing effort to get vaccine to those communities as well.
Rich, we're seeing schools reopen in much of the country right now, that new guidance from the CDC as well, but there's still a lot of confusion out there. Parents still worried, teachers still wondering what to do. What's your advice as a pediatrician?
Yeah, I understand everyone being worried. Teachers, parents, everyone wants to get kids back into school, and that's where they belong. What it gives me encouragement is that the science shows that if schools have what they need and are able to decompress classrooms, ensure people are wearing masks, do some screening, improve ventilation, you can have kids in classroom learning very safely, even before you have vaccination of staff and teachers. That gives me hope. You have to get the numbers down in communities, and those are moving in the right direction as well.
Rich Besser, thanks very much for your time and your information this morning. Thanks.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.